computer is picking up a strange signal. Here, sir, you better take a look at it.
Hello dear listener, and welcome to episode 66 of Life Through a Prism with your host Rob Tierney. In this episode we're going to take a look at an article from theconversation.com entitled "We Tracked the Mental Health of Trans and Gender Diverse Australians for over 20 years and we're worried." This is published on March 13th, 2025. The mental health of trans, non-binary and gender diverse Australians is worse than the general population, and the gulf is getting wider. Our new study, published recently in the BMJ Mental Health British Medical Journal, shows the gap has grown considerably since 2010, particularly for young people. This is the first time the mental health of trans, non-binary and gender diverse Australians has been tracked over time, for so long using data that represents the whole population. Here's why we're so concerned, and what we can do to help alleviate the distress. What we did. We sourced information from Australia's largest running population survey of households, the Household, Income and Labour Dynamics in Australia, or HILDA survey. This survey includes questions about mental health, which we tracked from 2001 to 2022. Since 2022, the HILDA survey has included questions on gender identity. This allowed us to identify people who were trans, whose gender identity is not typically associated with their assigned sex at birth; non-binary, who describe their gender outside of the female-male binary; gender diverse, whose gender identity differs from the sex they were assigned at birth, including people who don't identify as male or female; or cisgender, whose gender identity and expression matches the biological sex they were assigned at birth. So, we were able to compare the mental health of Australians who identified as trans, non-binary or gender diverse to that of Australians who identified as cisgender. What we found. Across the 22-year period, trans, non-binary and gender diverse Australians consistently reported worse mental health than cisgender Australians. Between 2001 and 2010, they scored 5 to 7 points lower on mental health, which is a clinically relevant difference. Between 2011 and 2022, the difference was even greater. Trans, non-binary and gender diverse Australians scored 8 to 13 points lower than cisgender Australians. We focused these increasing disparities over time were even greater for young people under 30 years of age. These trends remained even after controlling for other characteristics such as household income, education level, and living in rural areas. What's behind this? Several studies and reports indicate what could be behind these differences in mental health. Trans, non-binary, and gender diverse populations are more likely to face stigma, discrimination, violence, and other human rights challenges, such as refusal of healthcare compared with the general population. These experiences have profound and lasting impacts on mental health and health behaviours, such as seeking help for physical and mental health issues. Exposure to anti-trans rhetoric and discrimination against trans, non-binary and gender diverse Australians has been increasing in recent years. Trans, non-binary and gender diverse populations are more likely to experience gender dysphoria, the psychological distress that can arise when a person's gender identity does not align with their sex assigned at birth. Gender-affirming medical care, for instance with puberty blockers, hormonal therapy or surgery, can help combat gender dysphoria. However, many aspects of this care, particularly surgeries, are not currently funded in the public system in Australia, and not everyone has access to gender-affirming care, including young people who wish to start puberty blockers in Queensland's public health system. What can we do? Improving trans, non-binary and gender diverse mental health requires urgent action at multiple levels. if we are to avoid the devastating consequences for these Australians and their families. 1. Reduce stigma and discrimination. We need to reduce stigma and discrimination against trans, non-binary and gender-diverse Australians. We know discrimination or stigma directed at an individual, including harassment or abuse, and broader structural discrimination, for instance through law and policies, or broader community attitudes, impacts mental health of minority groups. Governments must implement policies that protect against discrimination, including banning harmful conversion practices in all states and territories. These practices, which attempt to change or suppress a person's gender identity, have been shown to cause lasting psychological harm. Trans, non-binary and gender-diverse Australians also need legal protections in education, employment and healthcare to help lessen and prevent the negative mental health impacts of discrimination and social exclusion. 2. Make services inclusive. Trans, non-binary and gender-diverse community-controlled organisations should be adequately funded to provide peer support, mental health services and training for other health workers. Ensuring healthcare providers are trained in how to deliver safe and welcoming services for trans, non-binary and gender-diverse people is essential in addressing healthcare barriers and improving health outcomes. 3. More gender-affirming care. Expanding access to gender-affirming care is also crucial to improve mental health. This includes reducing psychological distress, self-harm and suicide attempts. There must be a concerted effort to depoliticise this area of healthcare and acknowledge that gender-affirming care is essential, evidence-based medical treatment. We hope the National Health and Medical Research Council review of clinical guidelines for gender-affirming care in young people will help consolidate the evidence and counter misinformation to ensure that trans, non-binary and gender-diverse Australians receive the care they need. So there you go. What do you think, listener? Does it surprise you? Or is it what you expected? Or is it worse? Would love to hear your thoughts. Let's have a conversation. Till next time, take care and bye for now.